Good morning, I'm Noelene Armstrong, a peer work trainer and lived experience advocate from the Northern Territory Lived Experience Network.
And I'm Noemi Tari-Keresztes, a senior research fellow of lived experience from Flinders University.
In the spirit of reconciliation, we would like to begin by acknowledging the traditional custodians on the land in which we're meeting. For me, that is the Larrakia people of the Larrakia Nation. I also want to acknowledge the places in the Northern Territory where we have undertaken other work relating to the Northern Territory Lived Experience Network, and that's the Arunda people from Mabantwe in the Alice Springs region, and the Jarwin, Dagaman, and Waterman people whose lands converge around the Katherine region. It's also important for us to recognise those with lived experience of issues related to mental distress, trauma, suicidality, alcohol and other drug use. Reforming the mental health and related systems can only occur by valuing, respecting and drawing on the expert knowledge of individuals affected by these issues, their families and kin. Our programs actually draw on the individual and collective expertise of people with lived experience so that we may individually and collectively grow. It's important for us to provide some context about the Northern Territory Lived Experience Network. We emerged during 2020 when pockets of the Northern Territory Lived Experience community were empowered through two important peer projects. There were the Darwin peer-led education pilot, which was run out of the Northern Territory Mental Health Coalition and funded by the Northern Territory Primary Health Network, and the Promoting Peer Work project, which was funded by an NDIS ILC grant and administered by the Mental Health Association of Central Australia. Our network actually seeks to provide a collective and independent voice for Territorians with lived experience. It is the type of network that we see as an asset for system reform at a Northern Territory level and to contribute to national reforms. Our systems advocacy is unfunded. However, we have done our own formal submissions to the review of the Northern Territory Mental Health Act and the Royal Commission into the Abuse of People with Disability. We also frequently promote other lived experience engagement opportunities. Today, Noemi and I are going to talk largely about two of our peer-led education and support programs, Recovery Together for individuals with experience of mental health and alcohol and other drug and related issues, and Circles of Support, our complementary program for the family and kin of people affected by these issues. We have a third program called the Empowering Youth Program, which is for young people who are neurodivergent or who may have experienced adversity. We're also going to talk about the peer workforce development that the Lived Experience Network, with the support of allies, has created. It's a custom stepped vocational pathway from program participant to Cert 4 qualified peer worker. We recognise in the Northern Territory that our peer workforce is still emerging, and in many ways faces a lot of challenges to become established here. And it's for this reason that our work is nearly always evaluated, and we have a strong partnership and alignment with Flinders University. It's important to provide a bit of context about our past, current and future work. As mentioned, the Darwin peer-led education pilot was really pivotal for the formation of the Lived Experience Network. The PLEP, as it was known, involved the pilot and an evaluation of an interstate program, My Recovery, by Wellways Australia, in the local context. So that involved training local people to deliver an interstate program. It also involved the delivery of non-accredited peer work skills training to former participants and the early development of our locally produced community-led program, Recovery Together. Participants of the peer-led education pilot who did the non-accredited peer work training went on to become the first cohort of Cert 4 peer work students. And this was funded by the Northern Territory Department of Business with the support of Response Employment and Training, a registered training organisation that we have partnered with and continue to partner with. In conjunction, the NT Lived Experience Network, with the support of allied and auspicing organisations, was able to secure funding for our 3 peer-led education and support programs. So this began with the development and trial of the Empowering Youth program, which we delivered in Darwin, Palmerston, Katherine and Alice Springs. And that was funded by an NDIS ILC grant and auspiced by TEMCO. Then, with the support of Flinders University through funding that they secured from the Alcohol and Drug Foundation, we co-designed, piloted and evaluated circles of support for the family and friends of people impacted by alcohol and drug issues and mental health issues. And we ran 3 programs in the Greater Darwin region. Subsequent to that, we received our funding to pilot and evaluate Recovery Together. And with the support of the NT Primary Health Network, we piloted that program in an after-hours format in the Greater Darwin region before securing some additional funding to adapt Recovery Together and deliver it for the first time in Katherine and Alice Springs, as well as repeating the non-accredited peer work training, which we have the option for our former participants to do before going on to the Cert 4 and peer work. It was in fact our first cohort of local Cert 4 peer work students who co-designed and were employed to facilitate our 3 different peer-led education programs. Our new participants of Recovery Together and Circles of Support will do the peer work training shortly and go on to enrol in the Cert 4 in peer work, with additional funding received from the Department of Business and run through response registered training organisation. And it is these new peers that will support us to implement our future projects, which include a project that Flinders University has secured with support from the Community Benefit Fund to implement Recovery Together in relation to people who experience gambling-related harms, and another project with support from the Department of Social Services to implement Recovery Together for people who are unemployed. And we're really excited because both of those projects involve the delivery of our programs in Katherine and Alice Springs region. And we have for the first time the opportunity to employ locally based facilitators to join our network and become part of the work that we do. We're also fortunate to have repeat funding to deliver the Empowering Youth program in Darwin, Palmerston, Katherine and Alice Springs. In the presentation today, we'll be largely focusing on the evaluation findings of Recovery Together in that after hours format, with some early evaluation findings of Recovery Together in Katherine and Alice Springs, as well as the findings from our evaluation of Circles of Support. We'll also feature many images from the Katherine and Alice Springs programs. It's important to highlight the diversity of our Katherine and Alice Springs program participants. We learned a lot from adapting our program to deliver it in Alice Springs and Katherine. Our population in the Northern Territory is incredibly diverse, and we're also highly dispersed. So we make up 1% of Australia's population, but we cover 18% of Australia's landmass. Nearly a third of our people are Aboriginal and Torres Strait Islander people, and a significant proportion of people are also born overseas. We have adapted our programs in ways that we see are culturally sensitive, and we can create a shared language and shared understanding about recovery, no matter what our cultural background. And also we hope to meet the diverse needs of our participants who often have English as a third or fourth language. And this slide shows some of the wonderful participants from our recent Katherine program, which was completed in August 2023. This slide shows, in a format that's a little bit clearer, our STEP vocational pathway, which has been implemented in the Darwin region. So our participants of our programs have the opportunity to undertake non-accredited peer work skills training and roll into the Cert Forum peer work. And then they have the option to facilitate one of our programs. The slide says Recovery Together, but in actual fact, it could be Recovery Together or Circles of Support based on their individual lived experience, and help us to cultivate more future peer work students, as well as share recovery skills to the broader community where we have funding to deliver our programs. However, we know from local experience that a different approach is required in the Katherine and Alice Springs regions, where we had a lot of participants from remote communities attend our programs. And so we're starting to reconsider and rethink how we might be able to cultivate some wonderful people who attended our programs in those regions who have absolute standout leadership and peer qualities and a desire to take their learning back to community. And what we envisage is that we will co-create a peer work skills training with Aboriginal people from remote communities, and then they will have the opportunity to participate in facilitator training and potentially take some custom resources back to community. It's really important that this also maps to some nationally accredited training. We're not sure what that might look like, but what we do know is that the peer work units from the certificate in mental health peer work are highly westernized and Eurocentric, and that some elements of those particular units is absolutely not going to be relevant for our Aboriginal peers from remote communities. But ultimately, we'll look at coupling some non-accredited training, perhaps made purposely for this population, with some existing nationally accredited training. I want to talk a little bit about Recovery Together, the program itself. It is a balance of psychoeducation, recovery activities, and peer support that's facilitated in groups. Our groups have 7 or more adult participants, all with lived experience of mental health and or alcohol and other drug use. During programs, we connect, we discuss, we reflect, we're creative, we share knowledge and experience, we reimagine ourselves, but ultimately we need to have fun. Programs are delivered in urban settings over 10 3-hour sessions, and what we found to be more appropriate is for communities that include remote participants, 15 sessions where we can be more creative and spend more time talking seems to work a lot better. The recovery scrapbooks made by some of our remote participants were works of art, and they had enormous pride in the recovery resources that they developed. And that's what we're trying to highlight using some of the images on the slide. So within this setting, we deliver our psychoeducation entirely through the lens of understanding trauma and its impact. The CHIME model for recovery and the Aboriginal and Torres Strait Islander social and emotional wellbeing models are explored both explicitly and implicitly for all participants, no matter what their demographic background. These models are in fact the benchmarks that we've used for the program design and how we deliver it. Each model is also brainstormed during table discussions, recorded on butcher's paper. We learned during the Katherine program that a great way to share that with our participants was to type it up and to bind it in a book specifically created by that Recovery Together group. Other important elements of learning include the stages of change model, activities to develop motivation to change, knowledge of recovery, early warning signs, recovery planning, circles of control, automatic negative thoughts, relationship defaults, an exploration of values and needs, boundaries, communication, and self-advocacy. We like to say that the core themes of the program are self-awareness, knowing oneself, what matters to me and what I need, and self-regulation, knowing what helps, what I can do to have my needs met. Our participants have very diverse backgrounds, including suicidality, hospitalizations, dual diagnosis, homelessness, queerness, neurodivergence, and incarceration. Some of our participants might have NDIS plans. Others might be receiving a disability payment from Centrelink. Then we also have participants who are self-employed and might own their own business. There's a wide spectrum of people who come together and connect in our programs. Cultivating safety as well as connection within our groups is the most important thing. Really, our only requirement for participation in any of our programs is that a person has commitment to safety within the group, that they can come in and relate in a way with other members of the group that is psychologically safe for everyone. Our Circles of Support program also provides a balance of psychoeducation, recovery activities, and peer support, but is customised for the family and kin of people who experience mental distress and alcohol and other drug issues. In the past, we facilitated our programs using peers who have both carer and consumer lived experience. So that means they have their own experience of distress and perhaps alcohol and drug issues, as well as experience working as a family member or friend of someone who has those experiences as well. Programs are delivered over roughly the same period as Recovery Together, but have adapted to have a very strong focus on the family experience of families, carers, and kin. And this material is also complemented by carer-specific information and activities, one of the most important of which is shown on the slide. The family stages of change model, which is developed by Family Drug Support. And we use this particular model to help our participants have a greater self-awareness of how they're traveling and what they can do to improve their coping.
Thanks, Noelene. Our evaluation of the recovery and circles of support programs were co-designed with people with lived experience. A consultation workshop was held for each program, including local lived experience representatives and stakeholders. The evaluations applied a mixed method approach, including individual interviews, pre- and post-program surveys with program participants, and also individual interviews with program facilitators. From recent experience, we have determined that more work is required to support effective evaluation of our programs for remote participants. Since the quantitative assessment tools can be improved significantly, we found that even with support from facilitators, completing the standardized questionnaires was difficult for people who speak English as a second, third, or fourth language. Some instruments were also potentially triggering. Trust and connection are paramount. Relationship is key. We are exploring approaches that are more culturally responsive and ways to upscale the anti-lived experience networks of Aboriginal peer facilitators to ensure future evaluation better meet the needs of remote participants. So let's see the evaluation findings, now beginning with the Recovery Together After Hours program delivered in the Darwin region. We asked participants about their journey, experiences that contributed to and interfered with their recovery, their experience with the program, areas of program impact, and thoughts about personal recovery. Programs for this project were delivered after hours, as I mentioned, and participants described poor workplace mental health practices, injustice, workplace bullying, humiliating attitude, and moral issues as contributors to their mental health challenges.
How they operated was outside of my moral compass, and I fought with it. I thought, it's just a job, let it go. You don't have to agree with everything they do. But I couldn't. We were demoralized, called every name under the sun, spoken to like we were a piece of dirt on the floor. It just demoralizes you, and I couldn't let it go. I couldn't.
Some participants experienced peer support during the Darwin peer-led education pilot in another state or at another local service provider.
I used to live in another state and I went to a few activities, but that wasn't really cohesive, even though it is a good program. I have some peer support through a local service in Darwin, but that is generally during work hours, so it's harder to access. And I also found that they have less experienced workers.
Program participants also highlighted how critical it is in recovery to have ongoing access to the program.
I previously did my recovery course 3 times, and then when I saw Recovery Together was being launched, in the time lapse from my recovery to Recovery Together, I'd actually gotten unwell. And I know that this one was being put together to suit conditions in the territory, and I felt like it would help me to get back up again.
Participants negatively described their experiences accessing support services in Darwin. This included long waiting lists, complicated referral pathways, overeagerness in prescribing medications, involuntary admissions, and dehumanizing attitude of health professionals, including the mental health staff.
So those experiences in the hospital, including in the mental health team in the hospital, I found them the worst people to deal with. But I've been hospitalized for physical illness that comes from stress and the struggle that I'm having. And then because I have a mental health condition, the mental health team are brought in to assess me, and they dehumanize and focus on mental health instead of focusing on a medical condition.
The program offered opportunities for participants for self-reflection and self-discovery. Participants gained confidence and experienced a strong sense of belonging and acceptance.
Being able to advocate for yourself or get people to help you to advocate for you about things that you want to change in your life. Things that I changed were some of the medications I was on for bipolar had lots of side effects. So I managed to work with doctors and advocated to change my medication to give me a better quality of life.
The evaluation of the Recovery Together program in Alice Springs and Katherine is still ongoing, so we can only report early findings. Most participants had never experienced peer support, so they didn't know what to expect from the program. They felt grateful that the course was strengths-based and recovery-oriented, in contrast with their previous programs, which were judgmental and made them feel ashamed.
I expected different things from the program, but the course turned out to be a lot better than what I expected. I did expect a lot of confronting because the previous program I participated in was more like where you talk about what you've done wrong in the group environment. And that's where you're sitting in a circle and you sort of have to confront it in front of everyone. That is going to bring back those horrible memories that you're just trying to forget.
The program gave participants perspective and hope for a better future.
It opened me up a bit more, opened up my mind. I can see the world and different perspectives.
The participants were empowered and wanted to give the knowledge back to the community and support others in their recovery journey.
I'd like to do the same and become a lighthouse and spread, role modeling and being an inspiration, because the program does work. It's good. I would recommend it to anyone that's suffering, with a mental illness or addiction, because it was very helpful and insightful.
Participants learned different strategies to manage their mental health challenges. One of the most important learning they shared was the window of tolerance.
Now, instead of going straight to meltdown, I can actually pick up some of the signs that I'm heading toward meltdown and do some things that I need to do to recharge my batteries or whatever.
There were 6 main themes identified from the Circles of Support program evaluation. The interviews highlighted the complexities this vulnerable and highly stigmatized population experienced during their journey.
Having been a person with issues with dependency, I've been in relationships where I've been the partner of and loved one of people with drug dependency issues. I'm also a parent and my child has long-term issues with dependence.
Participants also share their feelings of loneliness, shame, fear, uncertainty, grief, and hopelessness through their own stories. Stigma was one of the most critical challenges they faced, which was even more significant for people from Black backgrounds.
With my culture, it's hard to understand anything about mental health and all that. For us, it's stigma. It's very hard for my family to understand these issues.
Participating in the program was the first time many participants experienced peer support that focused on their own empowerment and mental well-being. They were amazed by the power of the peer approach.
I felt part of something. I felt worthwhile. I felt better when I left, and I just kept going. It was a fabulous experience.
Participants were satisfied with the program and its impact, which completely met their needs.
I've done a lot of spiritual growing. I haven't felt overwhelmed. I think I've got new mental strategies. Even when the ship gets tough, I've got renewed hope.
The program empowered them, and some expressed the importance of participating in the evaluation interviews to raise awareness and spread the word in the community.
I learned that it's okay to indulge in self-care and have boundaries. I've never been good at boundaries. I give everything. And I'm completely exhausted, burnt out financially as well as emotionally.
Self-care was a core element of the program. Not everyone had a solid self-care strategy at program start. However, some families had already implemented self-care strategies before they joined the program.
Gratitude, that's a daily practice now. So that's kind of embedded, I think, the self-care. As we finish our presentation, we just want to draw your attention to the evaluations and publications relating to our work, which are available online. We'd also like to provide our heartfelt thanks to our funding bodies and the Territorians with lived experience who contributed to the development, delivery, and evaluations of Recovery Together and Circles of Support. Please contact us if you'd like to find out more. You can also visit our website or follow us on social media at Lived Experience NT on Instagram, Facebook, and LinkedIn. Thank you.
Thank you.